I'm asking all members, international societies, and Red Cross, and WHO, and law societies international to pressure on Israeli government to stop these procedures against the civilians and to stop the attack, to stop the war, stop the bombing against our civilians. People, please keep people living in peace. Israeli forces, one called me and asked me to evacuate the hospital, evacuate the patients, and evacuate everything within 2 hours, which is impossible. I told that I'm refusing this because I cannot distribute our patients. Most of them moderate cases, but others serious cases and needs more care and medical care, closed observation in the hospital. We losing humans because we have lack of facilities and medications and equipments. And the forces, Israeli forces, they are bombing the people, civilians people, children's, women's. This is actual true. And we are receiving most of injured patients in our hospital from childs and women's and elderly. We start to receive the injured from all over the northern area in Gaza Strip, and we received about 550 first 5 days, and the number increasing till now reach 575 injured patients, and the kind of injuries is different. This war, we observed a lot of patients. They came to emergency departments with bad odor and completely burned and multiple shrapnels all over the body. And we have a lot of injured patients with gunshot or shrapnels in the head. And this is the most serious cases. So we received, and we haven't in our hospital department of neurosurgery. So these patients need to be treated in the advanced medical center, and we refer these patients after stabilization. The situation in general in Sector Gaza really very bad. The health system suffering from a huge shortage of medications and supplements and consumables and fuel. This is the largest problem. No way to keep and maintaining the activities and providing services in the hospitals without fuels, because we haven't electricity since 7 days.
That was Dr. Ahmed Mohanna, director of the Al-Adha Hospital in northern Gaza, pleading for the war to stop as the hospital he directed was on the verge of running out of fuel. Stop the bombing against our civilian people, he said to NBC News 1 week into the war. On Sunday, December 17, soldiers raided the Al-Adha hospital in Jabalia, northern Gaza. During the raid, 21 health workers, including the hospital director and anesthesiologist Dr. Ahmed Mohanna, were taken under custody. After 3 hours of interrogation, all but Dr. Mohanna were released. The Al-Adha Health Community Association, member of the People's Health Movement, issued a statement denouncing the arrest and intimidation of its personnel and demanding the immediate release of Adha Hospital Director Dr. Mohanna. According to the United Nations, 90% of the population in Gaza, an estimated 1.9 million people, have been forcibly displaced more than once, up to 3, even 4 times, since the beginning of the war. People live on the streets in deplorable and unsanitary conditions, in makeshift tents that can barely withstand the elements, let alone bombs and air raids. They are especially vulnerable to infectious diseases that can spread rapidly in crowded conditions. In addition to war wounds, malnutrition, and chronic diseases, lack of water, food, sanitary batteries, basic medical supplies, the civilian population in Gaza is exposed to the most dire circumstances that threaten their survival. There is no health system left in Gaza. Only a few medical centers that remain are overwhelmed and do not have the capacity to withstand the situation. Humanitarian aid is in short supply and limited. The independent and international press has not been allowed access to the conflict zone. Amid escalating violence, governments, human rights and health organizations, and world leaders are calling for a ceasefire. Welcome to Charter4Health, a PHM podcast series on the right to health. Hear the voices and insights of health rights defenders at the forefront of the struggle for health for all from around the world. I am your host, Miguel Garcia, and this is Charter4Health, a new podcast series from PHM Global. Follow and share from wherever you are on iVoox or go to our website, phmovement.org. We are the People's Health Movement. Join us in the struggle for health for all. In this episode of Charter4Health, we address the dire situation of civilians and health personnel in Gaza, the international call for an immediate ceasefire to respect international humanitarian law and to stop hostilities against health workers and medical mission. Earlier this year, Anna Brachar, Charter4Health producer and chief editor of the People's Health Dispatch and one of PHM co-chairs, interviewed Dr. Tlaleng Mofokeng, United Nations Special Rapporteur on the right to health. Dr. T is a South African medical doctor and a strong advocate for the right to health of the people of Gaza and of an immediate ceasefire. In their conversation, they spoke about how the United Nations is actually involved in the context of the war in Gaza. This is what she had to say.
I just came from Geneva presenting my report at the Human Rights Council 56th session. And I must say, at the interactive dialogue with member states, I did start by saying to them that I have done everything possible, with the mandate given to me by the council and through its resolutions, with the working methods. And although I feel incredibly hopeless sometimes, I remain hopeful that we will have world leaders that can rise up still, even though they have shown incredible failure at the time of a genocide happening in real time, that they can still summon the necessary economic, political, and diplomatic power and influence to bring about, firstly, the immediate ceasefire, and secondly, the end to the occupation, but thirdly, some form of restoration and self-determination for the people of the occupied Palestinian territory. And so your question about, what the UN agencies are able to achieve is very varied, because the UN has agencies, of course, that are targeted at and whose mandate are humanitarian response. And we have seen incredible strength from those colleagues who have been working through those agencies. I mean, if you think about what UNRWA has had to deal with and the kinds of attacks that they've had to deal with on a political diplomatic space, but also early on in this genocide, the people who were killed were our own colleagues who were part of the UNRWA. Even though they were local nationals, I still, thought of it important to signal that if UN agencies are not respected and the UN agencies and its staff are not receiving the required protection, what does it mean then for the everyday person? And this at the time was already, like many of my own colleagues, signaling that there will be worse things to come. In terms of the, what can be done, I mean, we've seen the UN the independent expert on the occupied Palestinian territory herself, Francesca Albanese, do some really incredible work, and her latest report to the Human Rights Council, was really, really important. The everyday responses that she's able to summon as well. But unfortunately, she continues to experience very targeted and very personal and completely out of order, the kinds of personal attacks she's receiving from those who are in various countries, in various territories, and unfortunately, without much support or protection. We know that the UN Independent Commission of Inquiry on the Occupied Palestinian Territory, including East Jerusalem, has found, that Israel authorities are responsible for war crimes and crimes against humanity in their report of June 2024. We've also, had other colleagues, for example, the Special Rapporteur on Food, the one on housing as well, together as myself, also as a combined effort, continuing to call on for an immediate ceasefire. And the experts at the UN who are independent like myself were some of the first to call this what it is, which is a power asymmetry, which is intentional, willful murder and attacks on civilians and a genocide. And so I think on the one hand, even though I feel completely frustrated and enraged by the inability of the UN Security Council, the General Assembly, to bring about, the required ceasefire. I am filled with hope by the work being done by people on the ground, and of course, strategically, it's a difficult time because we see that even the methods that previously worked in these moments of crisis are seemingly not working now. So it's really a difficult time, but not a difficult time more than it is for the people who are living this horror of the genocide.
Thank you, Dr. T. And now just to touch upon something that you briefly also mentioned, actually, in addition to the UN agencies, of course, we know that there's a host of other organizations who are there on the ground trying to reach people, trying to work with the UN and Palestinian organizations to provide healthcare. So from what you are seeing from your report, what is the conditions that these organizations are working in right now, facing the obstructions that you touched upon?
So as an occupying power, Israel has particular obligations under international human rights law to maintain medical and hospital establishments and those services, right? And also upholding obligations under international human rights law in the occupied territory in relation to the right to health in general. And what's important about the right to health is that it speaks not just about accessing health facilities, but it also speaks about underlying determinants of health such as food, safe and potable water, safe, healthy and working environments, which currently cannot be guaranteed at all by any stretch of the imagination currently under this grotesque violence. And so what we have seen is you have a lot of individual people who are helping other people through crowdfunding and through other methods like buying eSIMs that can be activated by people when they need them. And it's really been difficult to provide any meaningful support because remember, the infrastructure and the destruction, the level of the destruction of civilian infrastructure has made civil society organizing really, really difficult, right? And so the targeting and the specific targeting as well of humanitarian workers does bring a chilling effect, which means that even those who wanted to help, who could get in and get the permission and be granted the permission to enter Gaza, they may likely no longer do so because the rules have completely being broken with absolute impunity. And so it becomes really difficult to organize in terms of non-state actors, civil society NGOs. But we have seen the usual NGOs, the physician organizations. We've seen UN, other agencies supported by UN networks that exist for access. But, when UN agencies themselves are unprotected and the workers there themselves are unprotected and unable to fulfill their own UN mandate, it becomes even harder for non-UN actors and non-state actors to provide that kind of really desperately needed support. But I must say, and I'm really grateful for the amount of activism and solidarity that does happen across social media, because we've been able to organize and connect with people in ways that without social media would have really, really been difficult.
Let's take a short break. You're listening to Charter4Health, a PHM podcast. Stay with us.
We are the People's
Health Movement.
PHM brings together health rights activists and organizations from around the world.
For over 2 decades, PHM health defenders have been at the forefront of the struggle for health for all.
We maintain an independent voice without fear or favor.
But now, we need you to stand with us.
We need your support to continue our critical and independent intervention on all health matters.
To contribute to our cause, go to our website, phmovement.org, and find out how.
Contribute
and say
proudly that you support
health
for all.
Health for all.
Health for all.
Health for all.
Health for all.
Follow the discussions on health issues at the World Health Organization on the WHO Tracker website. Through the WHO Tracker, PHM closely follows the work of the World Health Organization and prepares commentaries on agenda items at the WHO governing body meetings. These include background and critical health perspective analysis with recommendations for policymakers and civil society. Visit the WHO Tracker on the People's Health Movement website at phmovement.org. Join us in the struggle for health for all.
In late June 2024, Amel International Association healthcare facilities located in South Lebanon and identified as protected by international humanitarian law were targeted by artillery shelling. Dr. Zeina Mohanna is the executive board member with Amel Association International, based in Beirut, Lebanon. Dr. Mohanna is a PHM leading member in the MENA region. What is your perspective on the support that an organization like PHM can provide, and what is the role of Amel?
Actually, the PHM movement in general is something that Amel really commits to it, because at the heart of this movement there is really human dignity. There are righteous causes that are extremely important, where at the heart of it are the vulnerable population who are being faced with a lot of atrocities, where there is one voice for justice, one voice for dignity, and one voice for equality and equity in the world. Health, we know if we don't have adequate conditions of health, we cannot really sustain our living. And among the main mandate of Amel is the health, and this is the biggest program that we have been committed to ensure, especially on the level of the prevention through our primary healthcare centers that are spread all over the country, where we reach out to hundreds of thousands of people each year. So, and why it's important today? Because we are seeing that the world somewhere is diverting towards more capitalism and towards agendas that are far from investing more and more in the public sector and ensuring access of health for all. So this is where we are committed for the population, for the refugees, for the migrants, being in Lebanon or everywhere in the world, to really ensure access even for the undocumented. So today, we know that there is a big issue happening in Palestine, and where health is at the heart of it, and where healthcare providers are targeted directly. And this is a huge violation to humanitarian law. So next to our continuous efforts to ensure access to health and to address global health, also we want to remind and push to remind that healthcare workers needs to be respected, supported, safe, and alive. And this is a voice that we are really raising, because it's very important that these incidents are addressed and hopefully not repeated.
Let's talk about the situation of the right to health in Palestine at the moment.
And definitely, Palestine is not only about one country, it's about the cause of justice. And that's why we care in the MENA region that the voice of justice is raised, and also that this case is addressed in a way where we really remind about international human rights law and international humanitarian law. So definitely what's happening in Palestine is to be addressed, and we are hearing the voices everywhere. So again, access to health is something that we should not forget. But also we are faced with a lot of things that the world is facing, being climate change, which we know will increase migration and is already increasing migration. The last pandemic was a big issue, to also get the lessons learned out of it and see how we can prevent pandemics, to invest more in research, and also to try to solve a lot of problems that are around the world. We are in an era, we're already in the 21st century. Normally there should be a lot of diseases that should be eradicated in Africa, Southeast Asia, and other. So we're still faced with a huge number of challenges that are very important for our health. And we know the Maslow hierarchy of need says if we don't have our safety, security, health, which is at the bottom of the scale, we cannot acquire self-accomplishment and self-realization.
Layth Hanbali is a freelance consultant focusing on health policy. He's also worked as a researcher, public health practitioner, and doctor, volunteered as a civil society organizer, and taught on several global health programs. He's a right to health activist and People's Health Movement member. We spoke earlier this year, and I asked him about his perspective on the situation in the health sector in Palestine at the moment.
It has to be one of, it's definitely the most violent thing that anyone of my generation has witnessed, and it's hard. It's incredibly difficult to see the amount and the level of destruction that the Israeli occupation forces have been inflicting on the health of the Palestinian people. Obviously, in Gaza that's included the total dismantling, the total destruction of health, not just the health sector, but of health, of well-being, of life. And that obviously has been, one of the most difficult thing that any of us has lived through. I think at the same time, though, it's really important to put that in the context of it's happening because Palestinians continue to refuse to be erased. And so Dr. Ghassan Abu Sitta said it, put it really well in one of his interviews, where he said the Israelis are doing what they're doing, the brutality that they're inflicting, the amount of blood that they're spilling aims to drown us so that we forget the resistance, forget that actually there are so many incredible things that Palestinians have been able to do with the resistance. And that transcends everything that, all of the kind of various sectors and parts of society. So the very fact that there, is a health sector in Gaza, despite almost 2 decades of blockade, that is resistance in itself. The fact that you've got these long histories of health movements in Palestine that have accompanied the Palestinian struggle from, as early as the 50s, setting up, free clinics in refugee camps, going to the Palestine Red Crescent a few years later, and to the members of PHM, the relief committees and the medical relief committees and the health work committees, all of those being the health manifestation of Palestinian resistance. And so through all of the pain, the destruction, I think it's so important to think about that and draw strength from that. It's this struggle that's never ceased, and whether it's in the health sector or anywhere else, as defiance to the death machine that Zionism has been for the last 76 years.
I want to ask you about the future. What needs to be done to rebuild the health sector in Palestine after this is over?
The first and most important thing is that the people in Gaza are supported with everything that we have, to those who haven't left to stay, and those who have left to be able to go back to their homes, and to support with all of our might that as the first condition to anything moving forward. Because the reason there's a strategy to destroy the health sector in Gaza is part of ethnic cleansing. So if we focus on rebuilding life, on re-establishing all of the basics that are needed for life, and that means focusing all of our efforts on making any future free from Israeli occupation forces being in Gaza, the lifting of the blockade, the complete lifting of the blockade, and of course that being a kind of core set of conditions that are non-negotiable, right? So we start from that basis, and then that opens the chance for rebuilding and for reaffirming that Gaza will remain liberated land that we can build homes in, and pipes and electrical generators, as well as hospitals and clinics and all of the other essentials of the health system, but also life. And there's all of the wisdom of the Gazan people who've been able to rebuild before, who know that area better than anyone else, and who are able to lead that process. And so it's about really making sure that we, in the emergency of rebuilding and the urgency of it, don't lose sight of that people in Gaza can lead this, and they should lead this, and they will lead this. And our kind of our drive and our enthusiasm to support as other kind of global movement, for example, must be in step with that, and must be there to be part of an effort by Gazans. And more broadly, I think that we need to, rethink the way that we articulate our demands and our connections, to really reframe things around, for example, reparations, around that actually there are mechanisms that, whether it's from our imagination or from real life examples that, I think PHM is so rich for hosting, as an example, that we can use those ideas from different movements to, think about how do we reclaim land? How do we reestablish life and nature and revitalize nature, because there's also this ecological catastrophe that's going on, which is very familiar in lots of different areas. So we know that, in Morocco, Algeria, lots of sub-Saharan African countries as well, lots of Latin American countries as well, there's ecological destruction that colonialism brought, and there are so many lessons that we also should be learning about that. And that requires, I think, a kind of a radical rethinking and reframing of the way that we talk about our demands. And so ending occupation, removal of occupation forces, all of those things are basics that, that they're obvious that we need to call for them, but there's restoration that needs to happen as well. And that's something that I don't think we've maybe not faced it head on in the Palestinian context, but there's no escaping it, and that's something that we really need to think very deeply about, the reparations, and because that can open the conversation for the idea of total liberation. It's not just going beyond just repairing the wounds of this war, but reminding ourselves that the reason that Gaza is one of the most overpopulated places on earth is because the vast majority of that population are refugees. It's not just their lands in Gaza that we need to get back, but it's also their lands that they've been expelled from for the last 76 years that we need to also get back. So that shift in mentality can propel us with the movement to go beyond what we're being presented with and the frameworks that we're being forced to limit ourselves to go beyond that, to emancipation, to liberation, and that requires that the linkages and with other struggles.
We are the People's Health Movement, bringing together health rights activists from around the world. Join us in the struggle for health for all. This episode of Charter4Health was produced by Ana Orachar, Wim de Coquelea, and David Berstock. Editing by Luisa Fernanda Vitela. Technical support by James Von Dunen and Edwin Otzin. Special thanks to the United Nations Special Rapporteur on the Right to Health, Viva Salud, and the People's Health Dispatch. My name is Miguel Garcia, and this is Charter4Health, a PHM podcast. You can find much more about PHM and its call to action by logging into our website, phmovement.org. This is a People's Health Movement production.
Hey everyone, I'm Chiara Bodini, co-editor of the Global Health Watch 6, flagship publication of the People's Health Movement. I am also a producer of the GHW podcast. Listen to the first season of our podcast in English, Spanish, French, and Arabic on iVox. You can also go to our website phmovement.org/GHW-podcast.
An estimate of 39,000 civilians have been killed in Gaza. At least 113 journalists have been killed. 500 health workers have been killed in the war. At the time of finalizing the editing of this episode, there was no information on the health conditions or the whereabouts of Dr. Ahmed Mohanna.